Good evening, everyone. Welcome to our 4 p.m. Zoom lecture class. Today is the first day of a new chapter, chapter 13, the surgery section. So we're going to go ahead and get started. I'm about to share my screen. So chapter 13, we just completed chapter 12. Chapter 12 was a very short section, which was the anesthesia section. Now today is the beginning of chapter 13, surgery guidelines and general surgery. So this is a large chapter. We're only going to cover today the basics so that you have a foundation. Also, I included a video for you all to watch on surgery guidelines as well. That's in your daily assignment, the second little screen, and I have a video there for you all to watch in reference to surgery guidelines and general surgery. So we're going to go ahead, like a student is trying to get in. Okay, so. And then what I'm going to do today so that some students can get a better understanding, when we're going through this chapter, I'm also going to be referencing the PowerPoint slides as it relates to the chapter so that you all can get the understanding, a better understanding, because I know some people prefer reading through the chapter. Some people prefer reading the PowerPoint slides. So we're going to do both. We're going to go back and forth with the chapter and the PowerPoint slides. So here it says surgery guidelines and general surgery, chapter 13. The largest chapter in the CPT manual is surgery. So this is the largest chapter in the CPT manual. And then these are the guidelines. These are the objectives that we're going to cover in this chapter. Understanding the surgery section format, locate notes and guidelines in the surgery section, state the use of the unlisted procedure codes. That's the 3 that we're going to cover today. Introduction to the surgery section. The surgery section is the largest in the CPT manual. It is huge. So look at it. It covers the range from 10,004 to 69,990.
Goodness.
That is huge. So if you don't remember anything else on that NCCT certification, when they ask you what's the largest section in the CPT, you should know the surgery section. It's the largest section in the CPT manual, and that's always on your NCCT exam. Always. They ask you, what's the largest section in the CPT manual? The surgery section, which is going to be multiple choice, so you'll see it there. Surgery is divided into subsections, like a lot of the other chapters, they're divided into subsections. Most surgery subsections are defined according to medical specialty or body systems. So remember in anesthesia, we'll say like anatomic site and a different part. So surgery section is mostly defined according to medical specialty or body systems. So body system examples are integumentary or respiratory, which are systems, body systems. It says, take a moment to review the surgery subsections of the CPT manual so you can have a better understanding of the content. So if you have your CPT manual, look in that section and it'll show you how the subsections are divided. So I'm just going to move on, but I want you to look at that as well. Within the surgery section, some of the more complex subsections are the integumentary, musculoskeletal, respiratory, cardiovascular, digestive, and female genital subsections. So these are your more complex. So it means that it goes more in detail. These are the more complex sections. So make sure if you can highlight that to know what are your more complex subsections. Again, they're the integumentary, musculoskeletal, respiratory, cardiovascular, digestive, and the female genitalia subsections. Before we get into the details of the subsections, let's look at the general information that is pertinent to the entire surgery section. So in your CPT manual, going to be notes and guidelines. Guidelines are found at the beginning of each of the CPT sections. So do you all have your CPT manual? If you look in that, it said guidelines are found at the beginning of each of the CPT sections. That's going to be your guidelines, notes and guidelines. The section guidelines define terms that are necessary to know for appropriate interpreting and reporting the procedures and services contained in the section. The following is an example of the types of information located in the surgery guidelines. This is a student trying to get in contact. So these are the notes and guidelines subsections. Services. This is a reference explaining how to assign EM codes. CPT surgical package definition defines what is included in the surgical procedures. So when you look into your assignments and it's about a surgical package, you're going to look in the CPT surgical package. You're going to look at the definition. It's going to define what is included. What do you include in a surgical package? Follow-up care for diagnostics procedures defines follow-up care for diagnostic services. Follow-up care for therapeutic surgical procedures. So all of these things that explain to you in that section where you would want to look. An index at the beginning of each subsection within the surgery section lists subheadings, categories, and subcategories with instructional notes. So this is one of your daily assignments. Quick check 13.1. A listing of subsections that have instructional notes is not included in the surgical section guidelines. Is that true or false?
That would be false.
So where do we get that information?
At the beginning of the guidelines.
Correct. So when we go to our PowerPoint slides for this part, it goes and it breaks it down. Surgery section. The largest CPT section format, 10,004 to 69,990, divided by subspecialty, integumentary cardiovascular. Remember, I told you also make sure you read the gray sections under your PowerPoint slides. It says how many subsections are divided or included in the surgery section of the CPT manual. Look what it says here. It has 19 subsections with codes ranging from 10,004 to 69,990. So that's one of your test questions. How many subsections are included in the surgery section of the CPT? The answer, 19 subsections are included. Within the surgery section, the integumentary and cardiovascular are among the more complex subsections, along with the others that they stated. Notes and guidelines. Throughout section, information varied and extensive. So you have to read. You must read for this surgery section. You have to read all of the notes and guidelines. Guidelines are provided at the start of each section of the CPT. The information they contain allow the coder to appropriately interpret and report on the procedure and services included in that section. So it asks you, and it tells you the answer. It says, can subsections have their own notes with special instruction? In addition to the general guidelines, each subsection, subheading category, and subcategory of information included in the CPT is likely to have its own set of notes, including special instructions for use of the codes contained in that part of the CPT. These instructions must be followed for coding to be accurate. So you have to follow those instructional notes and guidelines in order to make sure that you're getting and you're coding correctly. Just because you see that code, you have to remember that it might be a change code or anything. So you have to read those guidelines and notes to make sure that you're coding accurately. So here's some example. CPT manual text changes. Reporting more than one procedure service. Why is it important to note any changes in the CPT guidelines accompanying a revision of the CPT? Revisions to the CPT are periodically released. New or revised text included in the CPT guidelines is indicated by arrows. You see that arrow in the text? That's indicating new or revised text included in the CPT guidelines. It says by arrows placed at the start and end of the changed information as shown here. So when it's a new or revised text, the arrow is going to be placed at the beginning and at the end. That's letting you know that it's been revised, new or revised text. So remember, the arrow is going to be at the beginning of the text and at the end if it's new or revised information. Subsection notes. As an example, consider the following notes from the musculoskeletal system subsection. This is in your book, shown in figure 13.2. Because this note is provided at the start of the subsection, it applies to the entire subsection. So if you look in your CPT manual, it shows you the subsections. So I'm going to go back to the chapter so you can see. So it shows you here, subsection. So the subsection, the first part that we covered was reporting more than one procedure service. That's the arrows. Starts at the beginning and at the end when it's text change. Next, we have the subsection, musculoskeletal system. Then under that musculoskeletal system is going to have the notes. It's telling you what it is. The services listed below include the application and removal of the first cast or traction device only. Subsequent replacement of cast and or traction device may require an additional listing. So it's giving you the notes and it's giving you the definition as well. So here we have spine. And it has here the subheading. So it shows you they have the subsection, the subheading, spine, vertebral column, then the notes. So you're always going to have notes, and you have to read those notes to be able to code accurately. Once you have the notes, then it has the category, grafts or implants. What's under that category? Have notes. So each section is going to have notes explaining to you what is included and how you would need to code it. Then it tells you here the section and the subsection. You look in your CPT manual, it's giving you, it tells you the section, surgery, the subsection, digestive system. So it says the instructions in the notes indicates the special instructions unique to particular codes or group of codes. The notes are extremely important because the information contained in them is not usually available in the section guidelines. So pay attention to what it says. The information in the notes indicates the special instructions unique to particular codes or groups of codes. The notes are extremely important because the information contained in them is not usually available in the section guidelines. So it's so important that you read those notes. Always make it a practice to read any notes available before coding. If notes are present, they must be followed if the coding is to be accurate. Make it a practice to write in your coding manuals. Highlight important points, make notes in the margins, and personalize your coding manual. You will find these personal annotations are very helpful as you code. So the most important thing is to always make sure you read those notes. Highlight it, document, because you need to make sure the notes that you understand what's in the notes before you code, or you may have inaccurate coding. Helpful information. It says resection of palate or extensive resection of lesion. And it says for reconstruction of palate with external, well, I can't even see, external tissue. So it has helpful information here, additional helpful information in parentheses. So it also will give you additional information in parentheses. So going back to the PowerPoint slides. So it says category notes apply to the entire category. Notes may also be placed at the start of a category of procedure or services, in which case they apply to all procedure and services within the category. Consider the example from the graph implants, category shown in figure 13.4. The note restrict use of certain codes to situations in which the graph has not already been used as part of the procedure. So see, that's important to know. If it's already been part of the procedure, then you're not going to code that. So you have to make sure that you're reading those notes. Subcategory notes apply to the entire subcategory. The CPT also includes notes for subcategories of procedures and services as shown in figure 13.5. These notes apply to the entire subcategory. Additional helpful notes, that's in parentheses, parenthetical information. Parenthetical notes provide additional information that will aid the coder in making correct coding decisions. So always read what's in your parentheses, always. Unlisted procedure codes. Use only when more specific category 1 or category 3 codes not found. Written report accompanies submission. Each unlisted code service paid on case-by-case basis. So I don't know if for my seasoned students, when we were in HICPICS and how they're saying unlisted codes and you have the right information and you have to, make sure that you include that written report of company submission. So when you're submitting a code that's unlisted in the CPT manual, you have to also have accompanying information, a written report explaining why you're coding for that. They said, are there any circumstances for which one cannot assign a listed procedure code to a procedure or service? Yes. When the procedure is not listed in the CPT manual, you would use an unlisted procedure code. What documentation is required for an unlisted procedure code? It tells you a special report describing the procedure. So you would describe the additional procedures that you did that was not listed, which is an unlisted procedure code. Category 3 codes may exist for procedures that lack a specific code within the CPT. In this case, the Category 3 code and not the unlisted procedure code must be used. A separate procedure. Separate procedures follow code's description, incidental to more major related procedures like a breast biopsy, before radical mastectomy, same operative session would not be coded, as only procedure performed would be coded. So it tells you, like, if it's separate, you're not going to do each thing. You're only going to code that procedure at that time. It says, under what circumstances are minor procedures coded as separate procedures? When they are the only service performed, or when they are performed along with other procedures that affect only body sites. when performed with another procedure, they are incidental to that procedure. So for example, a breast biopsy performed prior to a radical mastectomy would not be coded as a separate procedure because it has material significance to the mastectomy and affects the same body area. However, if the biopsy were the only procedure performed, it would be coded with use of the separate procedure code. So it depends on the body parts that's involved will determine if it's coded separately as a separate procedure or not. And it tells you again here on the PowerPoint slide, remember, separate procedure doesn't mean that it was the only one performed. It only indicates how the code can be used. And it tells you here, only procedure performed with another procedure on different site, unrelated to the major procedure. That's how it would be when it's a separate procedure reported. Minor procedures, often on service by service basis, often do not have bundle of services. Third-party payer decides what is in a surgical bundle. Minor procedure for Medicare has 0 or 10-day global period. Minor procedures are often provided on a service-by-service basis because they lack significant elements of preoperative and post-operative follow-up and tend to be straightforward and limited in scope. Remember, you all went to straightforward and you did that with complexity? You see how everything comes and it goes together? So all of this stuff, it comes back together. As you go from chapter to chapter, you see how everything becomes one. It's related. Major surgical procedures, on the other hand, are often coded as a bundle of services that reflects the standard care the surgical patient can be expected to receive in connection with the procedure. Third-party payers decide what is in a surgical bundle. So that third-party payer will decide and inform you when you send in that code for payment, what all can be included in that bundle. Medicare has the correct coding initiative edits. Specify what is in bundle. Third-party payers vary in definition of what is included in a surgical package. So depending on who that third party is, it can be different depending on who that payer is. So that doesn't mean that every third-party payer is going to have that same bundle. It depends on what they require. This will vary when you can and cannot submit separately for reimbursement. Major guidelines of surgical packages. This is very important because a lot of third-party payers differ when it comes to the surgical package bundling. Major surgical procedures usually include preoperative, which is before, intraoperative, which is during, postoperative, after, also known as global period, minor complications. So remember, we just went over this in chapter 12. Preoperative, before, intraoperative, intra means during, postoperative, post meaning after, and this is also known as the global period. The surgical package includes a global package that consists of the preoperative examination, the surgical procedure, and the postoperative period. When a patient is hospitalized and it is determined that he or she needs surgery, he or she would have a preoperative exam, and no EM, which is evaluation and management, changes after this day can be billed if they are due to the reason the patient is having surgery. The insurance companies set the post-operative global days period. Typically, it is 10 or 90 days. So do you all understand what that means as far as the surgical package? Once you put in that major surgical procedures, it's the preoperative. It tells you here. He or she would have a preoperative exam, no evaluation and management charges after this date can be billed. So once all of this, after this day, nothing else can be billed if it's pertaining to that procedure. And then it takes 10 to 90 days for that whole process to clear before that third-party payer, whoever is going to pay that bill. Major guidelines of surgical packages: one bundle, one price. Minor procedures may have no bundle, varies by payer. How are individual components of a complex procedure billed as a surgical bundle? The package of services is billed rather than the individual components. These include the operation itself, local anesthesia, and typical follow-up care, one related EM encounter prior to the procedure, and immediate follow-up care, including written orders. Which party determines the components of a specific surgical package? Each third-party payer may define the package differently. It is important to be clear of the definitions the third-party payer has applied to these procedures when determining how to bill for them. So you would need to contact that payer, whoever you're going through, whoever that their insurance company is through. It might be Blue Cross, Blue Cross Blue Shield, Humana, United Healthcare. So you're to contact that insurance provider or any third-party payer first to see what's included in their surgical package. Because like it states, each employer, each third-party payer may differ. They might not have the same definition of what's included in their surgical package. So before you bundle and put those things together to bill as a package, you need to first contact that insurance carrier to find out their definition and their guidelines for their surgical package. So a major guideline example: most payers specify 90 days after major surgery. All services related to surgery are in package, including pre-op, intraoperative, and post-op. Separate reporting equals unbundling. So that wouldn't be bundling if you had separate reporting. What procedures or services that are related to surgery are billed separately from the surgical package? When bundled services are delivered, all services provided during the standard post-operative period are included in the surgical package price. For major surgery, this period typically covers the 90 days following surgery. Most payers do that, but then some might differ depending on their insurance carrier. When minor surgical procedures are delivered, pre-operative and post-operative care are not typically bundled into a surgical package. Instead, all services are reported separately. The global period for minor procedures is 10 days following surgery. General anesthesia is typically not bundled, but rather is billed separately by the anesthesiologist. So these are things that you will have to know. And we know when you get ready to bill for services, if it was a minor procedure, if it was bundled, and this is where you will be in contact with the insurance providers, calling to find out what are their guidelines. What do they include, as minor procedures? What do they include as far as surgical packages? This is where you would get in contact with that insurance carrier to find out their guidelines, because most insurance carriers, their packages are different on what they include and what they wouldn't include. Never in bundle. So this is good to know. General anesthesia services reported separately by anesthesiologists are never in a bundle. General anesthesia services, we have covered all of this in chapter 12 for anesthesia, and reported separately by anesthesiologists. General anesthesia is a separate specialty and performed by an anesthesiologist. This is always separately reportable. So the key word, like I said on this, never in a bundle. That's just for the general anesthesia. Surgical package. Minor procedure includes pre-op and post-op services are sometimes reported separately. So remember, you don't see intraoperative in here. See that key word that's out of it? So surgical minor procedures wouldn't have an intraoperative. So pre-op and post-op services are sometimes reported separately. Same day may be included in performance of the procedure, can be reported separately if specified by payer. So this is again where you would contact that insurance carrier to see how would they want those services billed. Many minor procedures have 0 global days assigned to them. So you wouldn't have that 10-day global and that 10 to 90-day global period if it's a minor procedure. But this is where you would be in communication with the insurance carrier. This allows for separate charges to be billed for preoperative and post-operative services. This varies by payers. You see how they keep stressing how it varies by payers? Because each insurance company, their definition and guidelines may be different. Minor surgery example: needle biopsy in office, report procedure, biopsy, supplies, surgical tray. If there are no global days assigned to a minor procedure, could you bill for the post-operative visit 3 days following the minor procedure? Yes, if it's a minor procedure, only if it's minor. So this is a surgical tray. A surgical tray consists of needles, suture materials, wipes, and drugs. That's considered a surgical tray. Needles, suture materials, wipes, and drugs. You're going to report the surgical tray with 99070, CPT, medicine section, Medicare bundles, and 2 procedures. Last chapter in chapter 12, remember when we talked about when you use 99? The code's 99. So it says medicine section, Medicare bundles, and 2 procedure. A4550 HCPCS, not separately reported to Medicare. So it says it is a surgical tray billable as a separate item. The surgical tray is commonly included in minor surgical procedures. It is billable as a separate line item because it contains items not typically required for an office visit. So usually, like if you go into an office, you're not going to have for office visit needles, suture materials, wipes, and drugs in an office visit. So that's why that's not typically required, and that line item is billed separately. So it's a whole separate line that you would bill for. Reporting surgery, outpatient coders, physician payment professional, inpatient coders, hospital payment facility. So see, that's the difference. Reporting surgery, if it's outpatient, the physician payment is the professional component. If it's inpatient, you're in a hospital, you're in a payment facility. It says what set of codes is used for inpatient services and procedures and what set of codes is used for outpatient services and procedures. Outpatient coders address physician payments with use of the CPT codes. Inpatient coders address hospitals or facility payments with use of the ICD codes. That's the difference. Outpatient, physician payment, inpatient, hospital, and remember, inpatient is ICD-10 codes. ICD-10 codes. Outpatient tells you here, CPT codes. CPT, outpatient, inpatient, ICD. General subsection, 10,004, 10,021 is a general subsection. Fine needle aspiration biopsies with or without imaging guidance. Pathology, 88172, 88173, and 88177 for aspirate evaluation. So it tells you, what is a fine needle biopsy? A fine needle biopsy is used to withdraw fluid that contains individual cells. The needle is inserted into the area and moves several times to take multiple samples without withdrawing the needle. Note that fine needle aspiration biopsy is different from needle core biopsy. In the latter case, the biopsy site is exposed to the physician, who then removes a portion of the lesion for examinations. See how short chapter 13 was? But it's so important as far as the information that's in. So when we go through the chapter, so we went through that, and it tells you little bits and pieces. Beginning coders normally find it difficult to locate the necessary details from the operative report that they need in order to get the correct CPT code. So that's why it's so important to make sure you're reading your notes and your guidelines. If you're reading your notes and your guidelines, you're going to get the correct code. But if you're just coding from what you see on that procedure and you're not reading the guidelines and notes, you're going to code in error. And then you have here your exercise 1, musculoskeletal system general. So see, the difference is going to tell you if it's general or whatever. So that's the stuff that you have to pay attention to. And so this chapter, we went through special reports, separate reports, and they give you examples. But this is a short chapter as well. The surgical package, which we went through with the PowerPoint slides. On here, incision and drainage. They give you examples. And always read in your books. Always read your rules. Always read the rules. Very important. And then if you have, like where it says stop in any part of it, always read that. They have the general subsection. So this is a short section as well. And then your chapter review. So see, this might be a 2 or 3 day, might be a 1 or 2 day, 2 or 3 day chapter. So it's just very important. They want you to understand it's very, very important to make sure that you're reading your guidelines, you're reading your notes. So pay close attention to those guidelines and those notes to be able to code accurately. So any questions or concerns? I know that support, IT said that they are having difficulty with a lot of students from the campuses and online, having difficulty with uploading their assignments. So they are having difficulty. Some people are having difficulty with uploading or posting in comments. If you're having difficulty, please send in an email. But if you're able to upload, please upload a post in the comments section. Any questions or concerns? Remember, your exam is open through Sunday. Make sure that you're completing your assignments. I still have quite a few students who are not completing their assignments in a timely manner. Remember, this is how you're marked present for attendance. Once you get to 7 days of being absent, you will receive a letter from the online director saying that, you know, this is a warning that you might be placed on probation or whatever. So making sure that you don't get to that 7 days, they'll send you a letter letting you know that you're in jeopardy, you know, of being taken out of the course. So make sure that you're completing your assignments. I do reopen assignments, but not that I'm just opening them just because. So make sure that on a daily basis, you do that daily assignment. You have until Sunday to complete your labs. Make sure that you're doing those daily assignments because that's how you are marked present for attendance. I cannot keep stressing that over and over. I have so many students who did not complete their day 1, day 2 assignments. I had them reopened Once I reopen them and you do not complete that assignment, I will not be reopening assignments because I'm giving too much time. Remember, you have to treat your education as it's your career. You wouldn't be able to do that on a job. Everybody have things that come up. I do understand that, and I am willing to reopen. We all have things that go on. So it's not that, oh, you have to complete every assignment. But if you ask me to reopen an assignment and I give you that additional week or so to complete an assignment and you don't do it, then it's closed and I will not reopen it because that's not fair to other students who are posting and doing their assignments on time. So if you ask me to reopen and you tell me, like, give me a couple of days, please try to make sure that you complete that assignment in the days that you did request. Yes, any other questions? Any questions, concerns? So if not, I will be sending this to you all later on this evening. You have a question, Misty?
Yeah, I know probably after the CPT, I'm probably going to be going as a independent student, right?
I don't have that in my notes.
No, I was just asking, that's all.
As an independent, why would you be going as an independent?
Well, like, I was just wondering.
No, you don't go to independent unless you came in the middle of a module and you dropped and you were eligible to come back in.
Right. Okay.
All right. I
That's
do
what
have
I was.
several graduates that will be graduating in October. Several, and I'll be sending out that information. But remember, just if you have any other questions, just keep me posted. I will not be getting this to you. It'll probably be about later on this evening. I'll be sending this recorded video. But please make sure that you do that daily assignment. You do have a video that's posted in your daily assignment, so make sure you review that. This will be posted in your grade section of e-learning under Zoom. Remember to go under the Zoom class. This is where this video will be posted. I also posted the last video that we did for Tuesday. I posted that as well in news and announcements. So it was in two places, news and announcements and in your Zoom class, the grade section of e-learning. So you all have a safe weekend. I will see you all next week. Remember, your exam is due by Sunday. And if you have any questions, email or text me. Goodbye.